Welcome to the Chat with Chou podcast, hosted by Chou, well-being and belonging consultant, best-selling author, and sought-after speaker. Join Chou as she connects with both new and familiar faces, showcasing their inspiring work and businesses. Together, we will explore insightful conversations, practical tips, and valuable resources aimed at fostering individual and collective growth, both personally and professionally. Let's embark on this journey towards greater well-being and belonging together. Hello, everyone. Welcome back to another episode of the Chat with Chou podcast. And today I have my friend with me, Jackie White from the PEAL Center. Welcome, Jackie.
Hi, thanks for having me. I'm happy to be here.
Yeah, thanks for being here. So we'll dive right in. If you don't mind just sharing a little bit about who you are, what you do.
Sure. My name is Jackie White, and I am actually the Director of Outreach and Healthcare Access for the PEAL Center, which PEAL has a couple roles in the state, but we are the Parent Training and Information Center for the state of Pennsylvania. So we help people with disabilities and their families, their parents, navigate like the special education systems. We help them know their rights, feel empowered to have the tools that they need to advocate for their loved one. And additionally, what we do on the special education side of things, we can also kind of do on the healthcare side of things. We're also what's known as the Family to Family Health Information Center for the state of Pennsylvania. So we can help, with those questions like, my kiddo just got a diagnosis and I need to apply for Medicaid. What steps can I take? How do I connect? With that, help finding resources about, even things like paid caregiving and connecting people with those types of resources. And we serve all 67 counties in the state of Pennsylvania.
Yeah, and I know my family has benefited from lots of the support that the PEAL Center offers. So from my family to and other many families that get support from PEAL, thank you for what you do, what PEAL does, and what you do there at PEAL as well. But outside of PEAL, you also a parent. So a lot of the work that the things that you support us with, other caregivers, you also are living it. So it's not just work; it's life and work, like most of us, right?
Yeah, very much. Got into this work because I'm a parent. I'm so sorry, but that lived experience. And I can just share a little bit about who I am as a parent. I have actually 3 teenagers now having helped me. That
Too fast.
that all have disabilities, and a range of disabilities. And my daughter is actually someone who has a lot of medical needs, and we've traveled the medical journey. She's a special, she's got those special healthcare needs. So I have kind of, we'll say, as a parent, as an adult, grown up in the system and in the caregiver world. And so that's kind of why I'm here, right?
Right. Just that passion that fuels the work that you do too. It's not just clocking in and clocking out. For many of us, is we live this, so we feel what the families that we support feel, and then we were personally invested in this because this is our tribe, right? As well. Yeah. And so I know that, when you and I met, a couple months ago at the was that the DD conference, I
Yeah,
think?
the CHOP
Yeah.
Developmental Disabilities Conference.
Yes, and that's when I found out that you did research on caregiver stress. I'm like, I want to learn more about that and share about it because those are things that I'm passionate about as well. So just let us know like how you even came about to doing the research, and then we can, dive deeper into what you discover in your research.
So I went to Temple for my master's in public health. And as you may or may not know, when you finish a program like that, you have to do a fieldwork experience, and you have to do research, and you have to present at the Public Health Research Day. And immediately, I was like, oh, I know what I want to do. I want to see the effects of caregiving and what that has on health. And so, health, well-being, quality of life, all of the things that affects all of them. So I spent a lot of hours just like trying to consume research, trying to consume experiences, and just not even just for caregivers of like children with disabilities, but like adults, across the board. there are so many, an interesting number that I found that kept getting repeated was that it's like approximately 1 in 5 adults, like in the United States, is going to be in that caregiver role.
Yeah.
And when I'm saying caregiver, I'm talking like family caregiver, not like paid caregiver, is going to be in that role at some point in their life. And that's like a staggering number.
Yeah.
If you think about it. In Pennsylvania, from what I could find, and the data never keeps up with the year, right? So it's a couple years old, but
yeah, it was a few years behind.
Yeah. But it's like about 1 in 5 in Pennsylvania. That number seems to track a little bit with our state too. And so I was like, holy moly, we gotta talk more about this, and we gotta think more about this, because I think we're starting to talk a little bit more about making sure that people with disabilities, with special health care need, with mental health conditions, with all of those things are represented in everything that we're doing. We are not there yet, and we have way more work to do, but I think we're starting to talk about that. But I think we need to be having the conversation too about the people who are on the outside kind of providing care when that's needed, because they're kind of a group all their own with special conditions and needs that need to be met.
Yeah, yeah, and so true. I think traditionally our systems of care, not just in PA, in PA and
Right.
outside of PA, focus on the individual who have the diagnosis, right? The one that, the insurance is billing for, right? Or which provider they're seeing is charting the notes for. And then we forget that when our systems of care see that individual is for that 30 minutes with the doctor, sometimes 15 minutes, right? Never that long.
Right.
Or 1 hour or 45 minutes with the therapist. It's just that. It's those 45 minutes, those 30 minutes, 15 minutes. And then outside of those meetings, outside of those appointments, the families, the loved ones, the friends are the ones who are pouring in and doing the caregiving, right? 24/7. And I won't say nobody, like I know PEAL, think about caregivers and supports caregiving. There's quite a great organizations in PA who do the same. But I think as globally, as a bigger picture of just society at large, often the caregivers are forgotten.
Yeah.
And then, and you think about it, if we don't, it's almost like a house, if you don't have a strong foundation, everything that you put on top will crumble, right? So if we're not supporting the foundation, who are the people who are supporting the person with a disability, the person with a diagnosis, they cannot, no, none of us can sustain ourselves on our own, right? We need that community, we need that support. So even more so, those of us who have those quote unquote coexisting, pre-existing condition that qualifies us for disability, puts us in a disability bucket per se, it makes it even harder for us to be well if there's nobody around us, or the people around us are not supported as well.
Well, and interestingly enough, like in doing the research, but also just speaking as a caregiver alone, what we are not paying attention to, right, is the chronic stress that is put on the caregiver. And we all know it's in the studies, and this isn't new.
Right.
Stress has so much effect on your health, your mental health, your physical health, your quality of life, even like shorter lifespans, And when I was researching this, because I was like, I'll just be candid. I'm like, if it's like this for me, right? I'm sure that it's like this for other people, and even, and even more so for some other people who maybe don't have other external support systems supporting them. So, one of the things that like caregivers are at higher risk for, like job loss, which leads to financial instability. And that's just because, they're putting their time in. We talk about that 15 minutes at the doctor. That's sometimes a whole day for the caregiver that they have to take off work, because they have to get them there, get them in there, do the visit, get them home, get them situated, if they're able to work. So then you take that off there. And then if there's job loss, it's like financial instability, because also, not even to get into this, but the support systems that we have as far as funding sources where you can get more money, right? The thresholds are very low oftentimes for what you can qualify for. So then you're disqualified. And if you do qualify, it's probably not really enough to
sustain,
live. right? And so that was a big theme that I think when we're living in the caregiver world, we recognize that, but on the like external, I don't know if the community thinks about, oh, well, like they're putting in this time 24/7. How are they also putting food on their table?
Exactly.
And so that was a big finding. Another thing that I found in several studies, but then in also talking to some people is for caregivers, this reporting of feeling like isolated, like nobody understands what they're going through, what their situation is, and they often feel like they can't talk to people about it either, because it's like no one's going to understand, or they're going to say, can't you just do this, or can't you just find somebody to watch them, or just find somebody
Not
to,
that easy.
and it's not that, we know it's not that simple. And so that feeling of isolation was, another running theme. And I've felt that myself. It's like, oh my gosh, it's so hard to go out and go to the pumpkin patch or go do this thing. And people want you to be involved. I have so many wonderful friends who want us to be involved, and they invite us, but it's like, if you can never go, eventually they stop inviting you. And then
isolation just gets bigger. Yeah.
right,
Bigger.
it just gets bigger. And so all of those things also, there's just so much that there's the, back to the financial instability. We don't have universal like leave laws. So we have FMLA, but that doesn't necessarily make you whole. And there's specific
It does not apply to everyone either, right? It depends how big your employer is,
right,
and all of those things. Yeah. How
right.
many hours you work to even qualify.
Right. So there's all of those things to think about. Then there's, just even Pennsylvania, we know, from the work you do, Pennsylvania is a really unique state in serving people, also because we have, urban areas, suburban areas, rural areas, and access to resources, to care for even the person that you're caring for, but for the caregiver itself is definitely not created equitably across the state. And so it's very, that's something to consider too, when you have caregivers who are actually isolated and in the middle of the state, and it might be 2 hours before they could even find a support group, if a support group exists, or 2 hours before they could get to a doctor's appointment if they need preventative care, which then who wants to do that? Who wants to just drive for a shot or for something like that, and then it gets put off, and then that affects the physical health? So it's just it's a really interesting roundabout circle in a lot of ways. But one of the things that I've sort of been advocating for, and that we've been having discussions about at PEAL, is like, how do we find the caregivers? How do we get them connected? Because I think there is, at least for me, there was, and I read about this, even if you can find somebody who doesn't have your exact experience, just knowing that they have similar feelings or a similar experience can be supported. And, I did my field work for school with NAMI Philadelphia, which is also a wonderful organization. And they have like their family support group. They have a support group that's like a peer support group. They have classes, like their family to family classes. And I had the privilege of getting trained to lead those classes and to help facilitate support groups. And, you hear a lot of people's stories, and though every story is different, there are themes that pop up: the isolation, the, managing appointments and time. And like, that's the other thing. If you have a person that you're caring for, a child, whatever, that needs 24/7 care, when are you sleeping? When are you taking care of your health needs? And there's like, we know, right? The nursing shortage of home health aides. And even if you qualify for respite, can you find the services?
No. Yeah. Yeah.
So I get very into talking about this in case you
Yeah.
can't tell, because
I agree.
we it's just a place where there's so much room for growth, for expansion. And I
Mhm.
think recognizing, that that caregivers of people with, chronic conditions, physical conditions, they're kind of their own category when we should be talking about resources, supports, services. How do we help them? Like, I think right now we do talk about, like, PEAL is very family focused. We do
Mhm.
talk about families. We do talk about supporting families, but kind of, with relation to the person with the disability and the person with the special healthcare need. And I think that that's needed and great, and we have to work to their vision. But there's also, if we remove that from the conversation, I'll bet if you talk to some of our families, they would be like, oh, I haven't been to the doctor in years.
Exactly. Exactly. Yeah. Yeah, and
You
there's
know,
no time for it, right? Like, and even I was
right,
thinking when you mentioned like the example of someone living in the rural area, if they have to commute for for 2 hours just one way to go get a shot, and then it's thinking, okay, who's staying with my loved one during that time,
right,
right? So that's a 4 hour round trip, and you get there, you have to wait to be seen, and then you wait to check out, right?
yeah,
So half a day is gone, minimum 5 hours gone there, and then you're thinking, okay, 5 hours, who do I have who's available to support my child, my loved one, if something happens, well, in general. And then what if
right,
somebody's there, but something happens that they cannot take care of my loved one, right? You think, okay, I'm just going for a shot, forget about it, right? This
right.
is the other stressors of me going, outweigh seriously of me just staying and not going. And like you said, then things just accumulate. The own health starts
Yeah.
deteriorating.
If you even have somebody that can stay, and then your
Okay.
other option is like, does this person come with me? And that presents its own set of like
Right. Challenges.
challenges. Like,
Yeah.
is that worth it for this shot? Oh, I'll get it. Oh, I'll get it later. But
Mm-hmm.
I mean, just, I think that another thing to just kind of throw into the discussion here is that, like, even so, going back to if they are able to have a job, if they lose
Yeah.
their job, whatever. So oftentimes insurance comes with jobs. If you don't have a
Right.
job, do you not have insurance? If you
Mm-hmm.
if you don't qualify for insurance, some other way, then now you're also having to pay for your own
Out
care
of pocket.
out
Yeah.
of your pocket.
With no income or less income,
Right,
right?
right. With no income, less income, which isn't motivating. And even for a lot of families of people with disabilities, if their loved one has a form of insurance like a Medicaid
Mhm.
or a Medicare, those don't always cover all of the additional
No.
things that go into providing that care. There's typically a higher cost, across the board for that too, which was something that I found. It's like people always think, oh, well, you have Medicaid or you have this insurance, so why can't that just cover it? And it's like
It doesn't. Yeah.
it doesn't
Right.
work that
Right.
way,
Right.
and
Yeah.
it's more expensive. So it's all tied together. And I was so excited when you invited me to come
Mhm.
talk about this, because to your point, there are organizations that are recognizing it, that are starting to talk about it. So it's like, what can we do to make it more visible?
Yeah, yeah, yeah. And then I think the more, no, those organizations, right, are having continue to have this conversation, collaborate, the more support the families can get, right?
Right,
And
right,
even just going back to what you're saying about the whole financial piece, same, financial slash, medical with the insurance. People's like, well, your son, your daughter has MA, right? Medical assistance,
right,
so it should cover that. No, we have to pay X, Y, and Z out of pocket, right? And then when you start even same conversation goes along with when people who don't live our lives, or want to
mhm,
be, and the intention is good. And so
right,
I want to preface
right,
that with saying people who are
right,
well-meaning,
right,
who love
right,
us, who are friends,
right,
but who just don't get it because they don't live this life. Might say something, I've heard this enough to a friend, well, what if you just didn't work? You could just be on disability and then your family will be fine. I'm like, it doesn't work that way. Because yes, you have to qualify for that, but even when you do, then is that enough to cover what my family
right,
needs? Even just
right,
even just day by day, if there was
no disability or no, health concerns to begin with. No, it
Right.
doesn't. And then
Right.
so there are many people who are doing everything they can, many of us doing
Hmm.
everything they can to both work and then be present for a loved one, and realizing that it's a slippery slope sometimes, right? Unless you have organizations like PEAL, like the others who understand the challenges of caregiving, and are willing to support families and create those opportunities. Because
Right.
I've met so many caregivers like, well, I had a job, I have degrees,
Hmm.
I have great experience, but I cannot keep a job because I need the flexibility to run to the ER when I need to be, to get up
Right.
to my phone for a work meeting and be there for my loved one because they're having a meltdown. And
Right.
not all employers recognize that. So when you
Right.
pull outside of those organizations who are supporting families who are wanting to work and pushing themselves to work, also find barriers in the global workplace, right? At
Right.
large, because
Right.
the workplace does not recognize that, like you said, caregivers we are our own category of special needs, right?
Right. Right. Yeah.
From the healthcare needs to emotional needs, all of that, we have needs that needs to be addressed, and unless
Right.
everyone recognizes that, we cannot we will not support families and individuals well, because I think there's all these fragmented piece of society that, one, don't communicate, and two, when they do
Yeah.
communicate, the information is not, it doesn't come from the people who are living it, right?
Right.
So
Right.
people make their own ideas. Yeah.
And right. And like to, and to your point, I agree with you. I think that, most of the time people mean well,
Mhm.
and they want to support you, but when you step outside of this life and when you're not living it, there are so many pieces that go into it that it's really hard to
Yeah.
like have a frame of reference for. Prior to me being in this role, I don't think that I don't think that I ever would have really thought about it. And you know to your point, we're our own category of special needs. Agreed. And, when we put off like the preventative care, as so many caregivers do, when we put off the finding resources to meet our needs, our isolation, our support groups, that also tends us toward being more likely to develop
Mhm.
potentially preventable chronic conditions or disabilities, being more likely to develop mental health conditions, to be, more likely to kind of have some of the negative quality of life, and the things that go towards that, which then we're back in the cycle, right? And
Right.
and if we let ourselves get to that point, who is who is managing all of the things?
Right. Yeah, no one, right? No one. I often said,
Right.
if the captain abandons ship, and not because they want to, because they're out of commission, the whole ship
Right.
drowns. And that's often how I
Right.
describe my own family. It's like,
That's how you
yeah,
started. Right.
yeah, that's just the reality of it. And even work for many caregivers, I do a lot of work around trauma, and for many
Hmm.
caregivers, we don't even recognize that the stress that we go through, if left unchecked, leads to trauma. Because we first are like, well, I can manage this, things are not so, not as I wanted to, but I think I got this. And then we get to the point where I cannot, take care of this anymore. And it starts impacting on mental health, impacting on sleep, impacting on physical health. Before you know it, the list of diagnoses, accumulate, right? Whether it's, the migraine and the blood pressure and,
Right.
insomnia and all of those things.
Right.
And at that point, like our body, it's, deteriorating because of the stress we're under. And then naturally, we also have these internal narratives and internal stories of what what life needs to be, but it's
Right.
not because not because that's how it should be, but because that's what we've been accustomed to. Right.
Right.
And and I talked to so many caregivers who don't even understand that, honestly, that continuum of the stress
Right.
continuum, and how it gets to, gets to trauma. And I remember when we started doing trauma informed care workshops and support group for families, and many will say, well, I don't have trauma, like, and many of them will think about TBI, right? Traumatic brain injury, or my loved one doesn't have it. And we have to do a lot of education, like a lot of educating caregivers, like, no, yeah, TBI is a real thing. We understand that you can,
Right.
some people you can, as a humans, we can
Yeah.
have traumatic brain injury, but in this, we're talking about how the stress of caregiving alone become traumatic. And if we don't have the tools and strategies to address those, we start crumbling. And then, like I said, the whole, our family start, our loved ones and our family start also crumbling as well. So as part of some of the research you found done and for some of the work you do, what
Yeah.
are some tools, some tips that we can leave people with, some caregivers where can they start with addressing that stress so it doesn't turn into trauma? If they're really at the trauma place, what's the first step here to start recovering from it?
So, you've talked to people at our org about this, but we say it and it's cliche and it's really, really hard, but you have to prioritize your own self-care and your own mental health.
Yeah.
And, it's really hard because to your point, right, we put pressure on ourselves to manage all of the things, and this is how it should be. And if I say I'm struggling or if I say I'm drowning, somebody's going to think that I can't take care
Right.
of my family. So there's that stigma, which is
And the
another
fear,
huge
right?
piece
Yeah.
of this. But we also really need to be able to kind of recognize that every human being on the planet has limits, and you
Right.
have a limit, and it's okay to recognize that, and it's okay to ask for help. So one of the things that I would say is if you feel like you are struggling, if you're able to, as much as you're able to, reach out to even just your neighbor and just say, hey, I need to take a walk for 10 minutes. Can sit here with my loved one? If you're able, reach out to a PEAL or a Vision for Equality or a NAMI or any of those type of orgs and see what they might have available just to support you. And you know what? All you have to do is even just get your toe wet. Like if you want to go and you don't feel comfortable talking or you don't feel comfortable sharing, like that's okay.
That's okay.
Just
Yeah.
sit there with your camera off and listen. Like, and eventually you might feel like sharing or you might not, but however you need it. But I think that's the message that I would really, I think, like to be making sure that our caregivers are receiving, that like nobody can do everything.
Right. It's not
It's
humanly
okay.
possible. Yeah.
It's right. It's not humanly possible. It's okay to recognize that you have a limit and that you're at it or over it,
Yeah.
and ask for help. And it doesn't make you a bad person. It doesn't mean that you don't love the person that you're caring for. But I think that's like the first step. And it is so hard to do, which is why I think things like this podcast that you invited me to are so important. Because, for me, when I, got all of these diagnoses and coming up, it's like you don't want to admit that you need help. But when I hear people talking about it, like, yeah, that's my feeling too,
Right.
or
Yeah.
I needed that too. It lets you kind of put that wall down a little bit and say like, okay, I've experienced that and I need the help too. So, there are orgs that exist that in some ways are starting to try to be out there and help tackle this community. So I think it's okay to look for those. And you know what? If you're really ambitious, start one.
Yeah. Yeah.
Like if it doesn't exist, if you just need a friend once a week, say, do you want to have a video call once a week? And then invite this person in. Like I think that connection is a big
Yeah.
is a big piece. Our mental health affects our physical health, affects all of it. So, it's not an easy takeaway. I wish there was like a magic wand, but
No,
I
they're
think just
not. Right.
recognizing that it's okay.
Yeah.
It's okay.
Yeah, definitely. No, I totally agree. And I think sometimes, even like to your point, if you don't know where to start, sometimes it's thinking of looking at what diagnosis does your loved one have, and then just googling associations or foundations for people with
Right.
X diagnosis, and you start
Right.
finding many of them will have support groups online, and even Facebook. Actually, there's a lot of groups on
Right.
Facebook, and they might not have anything live that you can attend, but you can start asking who does anyone wants to
Ask the
connect,
question.
once a month, or you can ask questions about some of the struggles challenges that you're dealing with, because that community is so important.
Yeah.
And it's for any of us, it's so easy to think I'm the only one, like you said, Jackie, until we hear somebody else going through the same thing, like, oh, now, I'm not the only one. So I'm not creating this. It takes that guilt, that shame, that stress,
Right.
that tension, down a notch,
Right.
right? And then
Right.
we can start just, being a little more self-compassionate towards ourselves and be like, okay, I'm
Right.
human. What I'm dealing with, it's
Mhm.
typical for my situation, right? Now, maybe
Right.
not everybody deals with it, but this, it's not because I did anything wrong. This is the
Right.
result of years and years of caregiving.
Right.
I remember
Right.
telling a caregiver even recently, she was feeling bad, like we say, about just even taking that 10-minute walk, but to the
Right.
point where even when she was there physically, she was not there emotionally present because of just the stress of it.
Hmm.
So then she's like, well, I feel bad to even need that 10-minute walk.
Right.
Then I asked her, how many years have you been caregiving? And her son is in his 30s. And she said, it's been 30 some years. I came 32, 34.
Right.
I said, so imagine if you've been running a marathon for 32 years. All your
Right.
limbs will be like tired. You'll be out of
Exhausted.
breath.
Yes.
Like,
Right.
so I said,
Right.
but think about that in the physical sense, right? So if for 32 years you've been on the marathon, it's not even possible, right? But I say
Right.
if it was possible, naturally, every joint, every
Right.
muscle, every ligament in your body will remind you that you've been doing a marathon for 32 years. I said, well, think
Right.
about it in caregiving then.
Right.
Right? So your whole body's reminding you you've done a lot of good work, a lot of hard work because you love your son.
Right.
And it's okay for you to take that 10-minute break if you can, so
Yeah.
that you can then, refill yourself
Right.
and be present then emotionally and physically, not just being there and being so checked out because it's so many things. No, there are just so many things going on that are causing stress. And she's like, well, I never saw it that way. And again, power of community, right? Being with other
Yeah.
caregivers who can, relate, kind of helps all of us learn and grow together.
Yeah, and I think even, and like we say, if you can, if you can, if you can, because I do recognize
Yes.
that there are a lot of people where maybe that's not even an option, but
Mhm.
even if you can find something, um, if you like to knit or you like to
Absolutely,
crochet
yeah.
or something, you know, when the person that you're caring for is asleep, or maybe you have time to step away, if it helps you
Yeah.
knit for a few minutes, crochet, read a book, whatever you need to do. Secretly, I have been known to sneak away and eat ice cream because I love ice cream, right? I
Girl
guess it's
after my
not a
own heart.
secret now
Yes.
because I just put it out there. Um, because I love ice cream, but it's like you just have to find the 2 minutes, 3 minutes, 5 minutes,
Yes.
whatever you
Yes.
can, wherever you can, and just start
And your
there and
favor.
just I think for caregivers, one of the other themes is guilt, right? We
Yeah.
feel guilty when we can't handle it. And then we say, oh, we need to walk away. And then we feel
You're
guilty
guilty
because we
for
need to
walking
walk
away.
away
Mm-hmm.
because they're our caregiver. But I think, you know, that's what I love about, the organizations and the research and the literature and all of the things trying to draw attention to this, to just say, like, it really is more than any one human
Can
can
handle.
handle. And it does not say anything negative about you
Mm-hmm.
to just need a couple minutes. That is
Yeah.
like the most human emotion that there
Exactly.
is, right? So,
Exactly. Yeah, no, thank you. And thanks for bringing up the example of knitting. I remember days when I would take my kids to, physical therapy, occupational therapy, speech therapy, and I'll bring
yeah,
a book. I'll bring
right,
my headphones so I can listen
right,
to my song, right? I remember sitting there doing breathing treatment with my youngest one, and I'll have my favorite music in the background. Or sometimes,
right,
and it grew to all of us actually just having meditation music in the background because we all needed to chill,
right,
right? And
right,
so together, so sometimes you cannot escape, but then find ways to refill your cup while with your loved one even present.
right.
My kids love to swim and love to be in nature, and I could care less about, like hiking is never something I could do physically. It's too
Right.
much, right? But even back then when they were younger, what I end up doing, like I love sunsets. So, but we used to live in Dillsburg, so close to Dover and
Okay.
the Pinchot Park. So for people in Pennsylvania, so long story short, like we used to go to Pinchot Park at the end of the day in the summer where it was still daylight. I could catch my sunset. They could be swimming and digging in dirt for 2 hours.
Yeah.
That it worked for everyone. So you might have to be, and I know as caregivers we're very, very creative because we had to
Right.
make things work. So I
Right.
encourage you that same creativity that you've been putting into taking care of your loved one and make sure they're okay. Use that same creativity to think about things outside the box too that can help
Right.
you as well. And
Mhm.
sometimes, yeah, when you cannot escape, find ways to take care of yourself while you're taking care of your loved one, for sure.
Yeah.
For sure.
Yeah.
Yeah. So with
Yeah.
that being said, Jackie, where can people find you and how can we support your work?
So the PEAL Center, we have www.pealcenter.org is our website. We have a need to talk button at the top of the page. You can always fill that out, and we will get back to you. We have a pretty good turnaround time, and we can get you to wherever you need. If you're looking more for a training for like a family organization or whatever, you can request that right through the website. I myself am always willing to connect with everybody and would love to talk if anybody needs. You can find me on, Facebook, Instagram, LinkedIn, all of those spaces. PEAL, we have a physical office in the Pittsburgh area. We have a physical office in Philadelphia. It actually just moved. It's in a building called Pennovation now. And it's lovely, and we'd be lovely to have anybody stop in and visit if they want, or we have staff across the state as well. But really, all of our information's on our website. You can email us, you can call us. Yeah, connect with me, look me up. I'm so happy to have been here. You can reach out to Chou and she can get you to me if you want to connect. All of the ways.
Yeah, thank you so much, Jackie. Thank you for being here again and just having this conversation with me about caregiving stress. And thanks again for all that you do. And I know you and I will stay connected. For everyone watching, please share this. If you're not a caregiver, I'm sure you know one. There's so many caregivers in this world that can benefit from this. So please share the episode. Sharing is caring. And this might be, a way to also just, if you're not a caregiver, I want you to listen to this with an open heart, an open mind, and understand maybe the stressors that your friend, your family member might be going through as a caregiver, and maybe start brainstorming some ways to support. If not, and if nothing else, at least to be start to understand and do your best not to add more things to the to-do list, things that might seem simple, but for a caregiver who's already at max, it becomes a lot. So until next time, take care, everyone, and we'll talk to you soon.
Thank you so much.
Thank you for tuning in to the Chat with Chou podcast. We hope today's episode inspired and informed you on your journey towards growth. Be sure to subscribe, rate, and leave a review. Follow Chou Allegra on social media to stay updated on upcoming episodes and more resources. Until next time, take care and keep striving for well-being and belonging in all areas of your life.